Hello everyone, welcome back to exercise therapy class. We were discussing limb length and limb girth measurement. So last class we discussed what is anthropometric measurements, what are the principles of anthropometric measurements, what can be measured by anthropometry. We can measure the limb length and limb girth specially, and also we can see the changes at the muscular level. We also can see the asymmetry of the body parts and also can see the outcome of the surgical procedures. So some of the measurement tools that we discussed in last class were stadiometer, which is used for measurement of the height, soft metric tape, which is specially used for measurement of the length and girth of the limbs. Skin fold calipers as well as sliding calipers also were discussed, and one of these sliding caliper is also called as thoracometer, which is used for measurement of the foot length or girth. We learned about the spreading calipers, which is mostly used for measurement of the head circumference, and we discussed about the volumeter, which is primarily used for girth measurement. So last class we discussed what is limb length discrepancies. It is also called as anisomelia, and the limb length discrepancies can occur because of true limb length discrepancy or functional limb length discrepancies. Some of the causes for true limb length discrepancies: injury to the bone directly. Either the bone will be shortened or because of the fracture or because of the bone diseases or malignancies, etc., or replacement of the joints. Next was functional limb length discrepancies. It is not because of the shortening or lengthening of the bones, but it is because of the shortening of the soft tissues, because of the axial malalignments, for example, scoliosis or excessive ankle pronation, etc. Now let's move on to methods of measuring limb length. So what are the types of methods that can be used to measure the limb length? Primarily two types of methods are used. Number A, true limb length measurement, and number B, apparent limb length measurement. As you can see in the picture here, the true limb length measurement is taken from the anterior superior iliac spine to the medial malleolus, whereas the apparent limb length measurement is taken from the umbilicus to the medial malleolus. So this is the basic difference between the true limb length measurement and apparent limb length measurement. Let's discuss some of the general procedures or principles before using these techniques. First of all, before using these techniques, we need to introduce ourselves to the patient, and also we should take the consent from the patient for conducting the measurement on their body. To get the consent, we need to explain to the patient about the measurement techniques which we are going to use. Patient needs to be adequately exposed, or the part which is being measured should be adequately exposed. Therefore, the consent or the permission from the patient should be taken. And when we are examining the female patient, we should make sure that there should be a female nurse or assistant around the examination area so that the female patient feels comfortable. While examining the child, it's best to keep the parents beside them so that they feel comfortable, as well as it is ethical to keep the parents beside the child. So, all the procedures should be explained to the patient. First, we will examine the asymptomatic side rather than the symptomatic side. The measurement should be taken by the soft metric tape, and it should be taken in centimeters. First, we need to place the tape flat on the body so that the readings are visible to the examiner. The tape measure should be stretched properly to get a correct reading. If the tape is slack, then it may generate an incorrect reading. So these are some of the general procedures which we need to remember and follow. So the first technique is the apparent limb length measurement. For this, the patient has to be in supine lying position. that is patient lying on their back. The landmarks that is required for measuring apparent limb length measurement are the umbilicus and the medial malleolus. The one end of the measuring tape has to be placed on the umbilicus by thumb, and the other end should be placed on the medial malleolus. So this is a easy method. We have to just take the measurement from the umbilicus to the medial malleolus of one limb and compare it with the other limb and see the difference. To make sure that the ASIs are aligned in position, we have to keep 2 feet apart, that is about 15 to 20 centimeter, and it should be parallel to each other. So let's check the video demonstration for this apparent limb length measurement. Next one is the true limb length measurement. For this, patient has to be in supine lying position and squaring of the pelvis has to be done. So what is squaring of pelvis? The squaring of pelvis means the ASIS, that is anterior superior iliac spine of left and the right pelvis, has to be aligned properly. So to check if ASIS is aligned properly, we have to measure the distance of ASIS from the greater trochanter of the femur and ASIS from the umbilicus. So if the distance is not equal, that is if the left ASIS is not in equal distance as compared to the right ASIS with reference to greater trochanter and the umbilicus, then we have to move the leg to adjust the ASIs in a same level. So we can visualize the video demonstration how squaring of the pelvis is done and also the measurement using true limb length measurement. So for true limb length measurement, we have to measure from the anterior superior iliac spine to the medial malleolus using a inch tape or soft metric tape. Next type of measurement technique is also called as segmental location of difference or segmental measurements. So this is not as commonly used as apparent and true limb length measurement, but this also is a valid technique of measurement. So segmental measurement means the segments of the lower limb will be measured. So first segmental distance that is to be measured is from the anterior superior iliac spine, the ASIS, to the greater trochanter. So we'll record this distance and compare with the opposite side. Second segmental distance to be measured is from the greater trochanter to the lateral joint line of the knee. So this distance will be the second segment which will be measured. The third segment is from the medial joint line of the knee to the medial malleolus. In this way, we can measure the segments of the lower limb and see where the shortening or lengthening has occurred. So first from ASIS to GT, we can predict the length problem at the neck of the femur or in the pelvis bone. Whereas in second segmental measurement, we will see the length of the femur bone and compare with the opposite side. In the third segmental measurement, we will be comparing the length of the tibia with the opposite side. So before taking the limb length measurement, we can perform the test to see if there is a shortening. This test is called as Gallagher test. So in Gallagher test, we will ask the patient to flex the hip to 45 degree and knee to 90 degree. If we see there is a shorter limb, then we can predict there is a shortening of the tibia bone. And if one limb is forward to the other limb, then we can predict either the femur is short or femur is long. So these are some of the limb length measurement techniques. So first technique was the apparent limb length measurement, which is measured from the umbilicus to the medial malleolus. Second measurement technique is from the ASIS to the medial malleolus. That is called as true limb length measurement. For that, we need to square the pelvis first. So what do you mean by squaring of the pelvis? We need to check the alignment of the ASIS with each other. For that, we need to measure the distance of ASIS from the umbilicus and from the greater trochanter of the femur. Then we discussed about the segmental measurement, where first segment we are going to measure is from the ASIS to the greater trochanter, and second segment is from greater trochanter to the lateral joint line of the knee, and third segmental measurement is from the medial joint line of the knee to the medial malleolus. And here we have discussed about the Galeazzi test, where we'll ask the patient to flex the hip to 45 degree and knee to 90 degree. And then we'll see if there is a abnormal shortening or lengthening of the tibia or femur. Let us move on to limb girth measurements. So what do you mean by limb girth measurement? It is self-explanatory. Girth measurements are measures of circumference of the body part taken at specific anatomical sites of the body using a soft metric tape. So some of the procedures we need to follow for taking girth measurement, and the most important is to remove the clothings. If you are measuring with clothes on, then there will be inaccurate reading of the girth measurement of the limbs. The measurement should be perpendicular to the skin surface so that we can get the appropriate or accurate measurement, and also it should be perpendicular to the bone of the body segment. We also should remember that while placing the inch tape, we should not depress the skin too much so that it gives us inaccurate readings. Each measurement of the girth should be taken at least 2 times for accuracy. The first measurement, let's discuss about the arm girth measurement. What are the reference point for arm girth measurement? The first reference point is the acromion process, and the second measurement point is the lateral epicondyle of the humerus. The measurement is taken at the midpoint between the acromion and the lateral epicondyle. So you can see here the therapist places first point at the lateral epicondyle and second point at the acromion process. Then he takes the midpoint of this reference points and then measures the circumference of the arm. For measuring the forearm girth, the measurement is taken along the forearm at the point of the largest circumference. So the largest circumference of the forearm is mostly found closer to the elbow. If we are not confident with the largest point of the forearm, we can take 3 measurements near the elbow and then take the largest measurement as our girth measurement of the forearm.